post office or through the port. They just don't know where it's coming in. And so that's why I think the more light we shine on the port, the better. So if you're not used to the sunshine, sorry. 7:18. So that's going to be really fun. It's 9 a.m. It starts with the drug-free workplace port hearing, and then it's going to morph into the oversight hearing. And definitely, there's going to be fireworks. I think it's going to be pretty hot. It's definitely going to be the best oversight hearing of the year. Hey, it's Thursday, 2nd of February. Let's go into the K-Wave News Zoom room, where we have sitting by the Director of Public Health and Social Services, Director Art San Agustin. Good morning, Art.
Hi, Chris. Good morning.
Go ahead. Get situated,
okay,
yeah.
my audio's
right.
Hi, good morning.
Good morning.
Good morning. So, how's it going?
How's it going? Okay. Every day is a new day, and new challenges come up every day. We're very busy at Public Health, and so that seems to be today's norm.
Right. And so, if you guys are wondering to what we owe the honor of Director San Agustin being on the show, this conversation we're going to have is regarding a couple of complaints that we were able to receive about Bree, if you could.
Right, there were some allegations at the government quarantine facility, and there were some there were some nurses that allegedly were, I guess you could say, perpetrating fraud, not necessarily providing the care that they're supposed to be providing. They are the nurses that man the quarantine facility. They have a suite or possibly even suites at the Doucet. They were clocking hours that they allegedly were not working. Instead, they were at certain times allegedly were drinking on the job, or just not even there shopping. They were, this is quite a long list of issues that were provided in the complaint. And so weeks ago, this supposedly went to Adelup, the governor's chief of staff's office. Then I followed up with Adelup to figure out what is the status of this complaint. I was told by Crystal Paco San Agustin that they had forwarded to the Department of Public Health. So then I followed up with Public Health, and Janella said it was under review. After that, Senator Moylan had requested Speaker Teresa Lahi, who has oversight over public health, to hold an oversight hearing. And then Terlahi last week said that she had spoken with Mr. San Agustin and said that that there were no pending issues regarding this complaint.
But come to find out, now we have the director on the show because I maybe could just clarify things right off the bat.
Yeah.
Art, has this complaint been reviewed or investigated by the Department of Public Health and Social Services?
Actually, the complaints are being looked into. It's under investigation at this time.
So,
and so go ahead. I'm sorry.
Go ahead. So we're just a little confused because according to the Speaker's office, you had said that there were no pending issues. So
Right.
which is it?
Yeah. Well, we had an initial review of the allegations. It was an unsigned allegation, and I shared yesterday with Sabrina as well that if the person or persons who have information and have actual evidence of these allegations would be willing to meet with me or someone within Public Health Authority to provide us the evidence, we'd be more than willing to do that. There would be no repercussion of that person's an employee. We actually would welcome that. At the point when I spoke with the speaker, we had already done a review with the lead, and there was no indication of any wrongdoing with regards to what was alleged. Again, I want to share with everyone that it's an unsigned allegation. We don't have specific dates or times. It was a general sense of time fraud, drinking on the job. And so although we had the preliminary review at the request, we also decided to move it a little further, and we're now doing a in-person discussion with each one, which has been completed. We've also reached out to Department of Labor and Department of Administration if there's any further guidance they could provide us with regards to what steps we would take or need to take with regards to the allegations. And so it is under investigation, and we will be providing a report over to the committee as requested.
What made you decide to take it to that next level from it being under review to under investigation. What was it that triggered that?
Well, what happened is we were looking at what we have already looked at internally, and then with regards to the allegation, we said, wouldn't hurt to look a bit further. So I called DOA yesterday to see if they have someone in payroll, someone independent who could review time records. Nurses are working long hours, just the nature of where we are with the public health, and so they've really stepped up working 10, 12-hour days just to be able to cover the shifts that are needed, to cover the different response areas from the airport to isolation to quarantine. As you know, we now have vaccine pods. We have testing going on, still going on. And so we've got a whole series of public health responses that require our nurses to be at.
Mm-hmm. So you have interviewed everybody named in the complaint.
Right, and everyone has been interviewed, and so I also reached out, like I said earlier, Sabrina, to labor to discuss time and attendance with wage and hour. I called DOA yesterday to make sure that we're doing everything proper, and also because we're going to be submitting a report to the speaker, our oversight chair as well. We wanted to be sure that whatever information we give is within what we can release, given that it is a personnel matter.
Mm-hmm.
And we want to be sure that we also don't violate any employees' rights or personnel information. And so that's where we're at.
The individuals named in the complaint, are they on leave pending the outcome, or are they still performing the responsibilities that they're assigned?
That seems kind of standard that they would be put on some kind of leave while they're being investigated. Is that the case?
Well, not at this time. We have not placed anyone on any type of leave. They actually continue to remain within their responsibilities. We are making adjustments internally with regards to line of supervision, and that was being further discussed yesterday afternoon. And so that will go into effect this week in terms of line of supervision.
Why do you think the complainant would make this complaint and not leave their name?
Chris, I really don't know. I'm hoping that person would be willing to meet with me, just to sort this out. Any wrongdoing on any level, we definitely want to discuss that and look into it further, especially if they have evidence of any time fraud. That would definitely be dealt with properly. But it's really difficult when you generalize and say that they're working long hours. Many of the nurses, a good number of nurses, even non-nurses are working. When we work Monday to Friday, the team, and then they also work on Saturday and run a vaccine clinic. So you are going to see increased number of hours to include overtime.
So performs time fraud of 100 hours per week, not allowed and against bylaws restrictions for an individual to work such hours daily, weekly, as a healthcare worker is unsafe. Signed off and acknowledged by this particular individual, not questioned by public health timekeepers. That's information, wouldn't it be, that you would automatically be able to see?
Right, yes, and the 12-hour shift, in speaking with labor, is permissible. They compared it to the fire department, in which employees work 12-hour shifts, and so they are entitled to a break. And I just wanted to be sure that these hours are proper and that this work schedule is permissible. Also, we're sure that this also is a work schedule used by other government agencies, like in hospital settings. There are times that even correction officers are asked to stay back and work these long days. Mm-hmm. So, just want to be sure we check with labor that we're not violating any Fair Labor Standard Act provisions, but also checking with DOA to be sure that these work hours, this work schedule is permissible and proper. And from what I received from both agencies, they appear to be proper, working a 12-hour shift.
Art, how does it work? These nurses that are assigned the government quarantine facility, are they assigned suites or a suite at the Dusit?
Well, actually, yeah. What happens is, it's part of the contract, actually. This started even when we first opened the quarantine facility back in, March or so. What they needed was 2 rooms, one for donning and one for doffing. So they would have a changing room, so they would prepare and dress up for to put on their PPEs, so that when they go out and start swabbing the travelers there, they would be fully protected. And so that's that room. That's one room that they use for that purpose. The other room is where they actually operate kind of like their office. And so It is a hotel, and so the two rooms are dedicated for that. This started back under the initial contract, and the practice just continued on today. So the nursing staff have an office to work out of, and another room to change when they're going to meet up with the travelers who are in Quebec.
So they
And
have
be swapping.
okay.
Sorry,
So they have 2 suites.
they have two rooms. Yes, I know they're called suites. I probably need to go look at them and see what they look like, but I understand there are two rooms that are just dedicated for the nurses to use as an office for one, and the other for changing out and putting on their PPEs, and then of course changing back to getting out of their PPEs.
And so, what kind of shift do they work if they're assigned to the quarantine facility? Is it like a 12-hour shift, a 24-hour
Well,
shift?
we have, yes, you're right, Sabrina. It is a 12-hour shift. We have a contract from 8 a.m. to 8 p.m. The area that was not covered was 8 p.m. to 8 a.m. So our nursing command supervisor, resource commander identified nurses that would be willing to work the 8 p.m. to 8 a.m. shift. And that's the crew that where these allegations are lodged against.
The 8 p.m. to 8 a.m. shift.
Yeah, and so that time period was not covered by the contract. So public health needed to identify staff to cover that period, and that's where the three nurses, three to four nurses, I'm sorry, were identified to provide the coverage during the 8 p.m. to 8 a.m. shift.
Art, can you confirm at all if any of the subjects of the complaint are high-level nurses in management with the department?
No, actually, these are individuals that, in speaking with them, and I don't think I'm going to be disclosing too much. One of them actually was already working for a clinic, saw the opportunity to help public health, and she asked her employer if she could switch over to public health, and the employer said, "Are you sure?" And she's like, "Yes, I really want to be part of the response. I want to help public health." So she came on board, and her former employer today said, "Don't worry, when all of this is done, you're welcome to come back." So we have one that is a dual role, works in the education system, but also assists us at the QFAC. So these are not current public health nurses on board. These are individuals that were picked up in response to the effort needed to provide nursing services in our public health response.
So you're saying none of the nurses mentioned in the complaint work for public health full time?
Well, there is one, the one that was, which of course is our manager. She is with public health, but three of them that I spoke with that were listed in that complaint, they actually are not yet working with. They're not public health employees prior to the pandemic. Just to be clear. So one came from a private. Sorry.
Are they employees now?
Well, they're employees now. Yes, they're brought on in response as part of the response effort to build up our capacity with nursing, and so they're with us now.
And so one of the nurses who is one of the subjects of this complaint is a manager.
Yes, she is a manager. She's one of our administrators in the department.
And so she's still on the job while you conduct this investigation?
Yes, she's still on the job. Earlier I said we're going to change the line of supervision, and that's already been agreed upon yesterday. So over at QFAC, we do have other staff, and all the nurses at QFAC will report to the QFAC person in charge there.
Mm-hmm. What are your thoughts about the picture and that video that shows some of these individuals drinking and cheersing and talking?
Yeah. Well, the only thing I really needed to be concerned about is really primarily the concern of the video in relation to the allegations, and based on the individuals, they presented information that showed they were off the clock, which is something that we are going to verify, that they definitely were off the clock. They provided us the date of the event, the time of the event, and so we'll verify with their time records to be sure, that they actually were off the clock, and so that should be settled very soon this week.
Okay, because if you're saying that their shift is 8 p.m. to 8 a.m., what, they were drinking before they clocked in? Or they were drinking after they got off at 8 o'clock in the morning?
Right, yeah, that's right. That's why we want to verify, because according to the individual's interview...
Happy hour, and then let's go clock in. Time to go. Let's go. We got 500 packs.
Right, yeah. So in speaking with them, what they did say to us at this point was that they were not on the clock, that it was their time off. So that's what we wanted to be sure about. And so they provided us even they showed us a video in which it was timed, and so we have the date and the time. And so we just need to go now and cross-check the timesheet for that day to be sure that they were actually not on the clock. That otherwise would prove, if they were, that would otherwise prove that the allegation in that one regard is true.
Art, just to go back a little bit, when did this go from something under review, and was there anything in the complaint or any of the information that you found while you were reviewing the complaint that made it go from under review to under investigation?
Well, what we really wanted to do was, one of the key concerns was really the allegation of time. And so that's why I've actually reached out to DOA to ask if they have someone within their agency who could review, basically audit their time records to see if they find anything that is questionable, that, and of course, like anyone in doing this for the department, we're hopeful that there is nothing to be found, especially with time and attendance and logging in hours. That's, of course, our hope at the end. But if something is identified that is questionable and proven otherwise, then we have no recourse but to take action.
What would you say is the most concerning part of this complaint? Because they list like 5 different incidents for. Actually, there's quite a few incidents here.
Yeah, for every concern, again, Sabrina and Chris, really one of the most concerning for me above all this is really it being unsigned, and so it could really be a host of allegations of someone that is not content or maybe felt there was some wrongdoing done to that person. But when you look at all of it, it's all concerning, from the allegation of patient care to the allegation of drinking on the job, time fraud. I mean, all of these are very concerning, but primarily, of course, the health of the patient, the travelers, is of absolute top concern for all of us. Time fraud is proven, but we want to be sure the quality and care of our patients is not compromised.
Did you have a chance to follow up, though?
I'm sorry.
Did you have a chance to follow up on the additional complaint regarding one of these individuals that was named in the initial complaint threatening employees, trying to find out who made that complaint, who is complaining about me and these nurses at the quarantine facility?
Actually, Sabrina, yes, we did talk about. I'm sorry. Okay, there. Yes, actually, Sabrina, to your question, yes, that person was called in already. There was no effort made on that person. The person reported no effort made on that person's part to do anything that was alleged in that follow-up. And so that is also being interviewed as recent as yesterday. I just received that yesterday. So that person was called in. The person was interviewed, and there was no confirmation of that.
Right.
And so, again,
of course, I'm not. Yeah. If I was the person that they were accusing, I wouldn't be like, hell yeah, I threatened that person. Who do they think they are?
Right. Right. But we do need to interview the person, and that's why, as I shared with you yesterday, the person alleging or putting forth these allegations. I really want to ask if you would consider giving me a call, or even just sending me an email, or setting an appointment and just saying, I need to see Art. I need to see the director, and we can have this in-person conversation. If there's any evidence out there to prove these allegations, we welcome those documents. We welcome that interview so that we could take this matter to the next level. It's really difficult when it's unsigned. There's no date.
Right. Yeah, but Art, when the complaint is alleging favoritism and all the other things that it alleges, of course, it's going to be submitted anonymously because it's clear that this complainant feels like there's retribution. So, I mean, I just feel like it's almost pointless for us to dance around. They didn't leave a name. But, it's also good to hear that you guys are looking into it.
Right. So, Chris, with regards to favoritism, I hear you. And so that's why we were changing the line of supervision. Because there is a relationship that exists, which was in the allegation. That is true. And so we are changing the line of supervision so that the relationship in terms of supervision will not exist.
Art, we do actually have somebody commenting on our Facebook stream that says, My daughter and I were in QFAC a few weeks ago. My daughter was sick, and the nurse extension was never answered. Finally, the National Guard came and helped my daughter. And, you know, it actually isn't the first time I heard that, that they would call, but no one would answer because they allegedly were out, you know, doing whatever.
Allegedly.
Yeah, and
allegedly.
Yeah, and definitely, you know, anyone really who's in QFAC who's having an experience, and I might just be inviting a flood of phone calls and messages, but you know, it is what it is. And so, if there are other concerns like the one on Facebook, which I'm in the car on my phone, please welcome them to call me or send me an email, arthur.sanagustin@dphss.guam.gov. Give me date and time, and you know, we'll look into it. We really will look into these concerns because the nurses are supposed to be available from 8 p.m. to 8 a.m. And if we have, like the Facebook, we call it and no response, we'll look into that situation. Every concern will be looked into for the services that were supposed to be provided to our QFAC occupants, residents, travelers, and were not responded by the nursing team.
As part of your investigation, have you tried calling the National Guard to see if they've had any issues with these nurses? Because they would know if they aren't answering the phones or not there.
Yeah, we would definitely. That's a very good point, Sabrina. Yeah, we have not reached out to the National Guard. We just completed the interviews yesterday with those that were listed in the complaint, and so that definitely is an option for us to pursue. And so, thank you for that. But I know that Sabrina, when we spoke, I shared with you also that I have another 740. So I'm not trying to get out of it.
No, I understand.
They're just sending me.
Right,
me a text saying, "Hey, you're on in a minute." So,
yeah. So it sounds like there are pending issues then.
Well, the issues that we have is just we're waiting for DOA to give me confirmation that they can look at the time records, and so when they can do that for us, that'd be great. It's also because it'd be independent. It wouldn't be, someone from public health reviewed those time records, and it's within the department, so we can get someone external. I think that would really give it a lot more sense of non-being biased because it is an external agency reviewing our time records. And definitely pursue the guard discussion, Sabrina. Thank you. We'll have the team look at that as well.
All right. Well, thanks, Art. I really appreciate you coming on. I know you're limited what you can say, but really appreciate it.
Thank you for understanding.
Yeah.
Yeah. Thank you so much, Chris. Thank you, Sabrina. Thank you.
Appreciate it, Art.
Take care.
All right.
Stay safe.
Take care. Bye-bye.
Hasta.
Well, it's under investigation.
Now it's under investigation. It's not under review.
It's under investigation.
Okay, because it was under review before, and then we were told there were no pending issues, but now none of that is true. The opposite of that is true. So it is under investigation, and there are pending issues. But if we're going to send the timesheets over to DOA because they're impartial and it'll